right, guys, and we are back. So let's get into. We have several to do. We have one, two, three, four, five. We have five more to do, so we'll run through them. Okay, so let's go. Human resources. Well, we did human resources in pharmacy administration as well. So this shouldn't be too difficult. Utilizing a systems approach on slide 2, input, process, output. It's a very good diagram. Determinants of healthcare success. We spoke about the internal customer, the external customer. As an employee, you would be an internal customer. Your patients, your persons coming to get your service, to utilize your service is your external customer. And they want satisfaction, and employees want satisfaction, and both of those lead to organizational success. We looked at on slide number 6, the science of healthcare and the art of healthcare. Science is delivering high quality products using scientific and innovative technology. Metrics would be involved in science as well, in measuring. In the art of healthcare, managing human beings who provide the service. Challenges for health systems, as we mentioned before, governance, finance, and infrastructure. Right, the dimensions for a human resource in health performance: coverage, productivity, technical quality, socio-cultural quality, organizational stability. And there are some challenges of the health sector on human resource. Slide number 10, it's a good slide to take a look at, given some notes there. And we spoke about workforce imbalances on slide number 11. Mismatching of numbers, shortages versus surpluses. There are some areas in healthcare where, in certain communities as well, there are a large amount of healthcare worker in this particular field, and in other communities there are shortages. Getting that right balance to get your complement, your staff complement. And there are some policy issues for human resource in healthcare in the last slide, on slide number 13. So the human resource, we did human resources in farm admin as well, so it's very similar. Very similar. In public health, you would look at human resources in particular, would have to consider unions, would have to consider public health policy, health and safety as well in their strategies. So that is human resource. I'll move straight on to how is healthcare funded. And we looked at the financing mechanisms. We looked at, going straight to it. Well, we spoke earlier. We spoke earlier about that. We had some examples of Europe and Africa on how the funding was spent on different diseases, how it will change based on the continent that you're on, based on the climate that you have. And we looked at health financing to be risk pooling, the collection of resources that you can help to make predictable and cover for it. So risk pooling would be your national health insurance, national health service, like what is currently what we have in Trinidad and Tobago, which is one that is state funded. And I want you to take a look at slides. Right. Please note that in no country, one method of financing is used, you would have several options that would be utilized by different populations in a country. And we're going straight to slide number 18, where we looked at the national or state-funded healthcare, which is what we have, its strengths, its weaknesses, and the characteristics of it. Social healthcare system, funding from employee and employer. That's like your company having a group health insurance plan. There are strengths, there are weaknesses to that as well. And voluntary or private insurance, your own, you pay in for individual private insurance on your own, which is what I would recommend. If it is you are employed with an organization that does not have health insurance, I urge you to put aside some money to cover yourself for health insurance. And as future health professionals, I also urge you to take out professional indemnity insurance. You're not just health insurance, but professional indemnity, meaning should something happen while you are performing your professional duties and you are asked to account for it, that you have insurance that can cover your legal fees, etc. It's important, and let me put that in here. Professional indemnity and also personal health insurance. All right, these are things that I urge you to have as young professionals going out there into the working world. And then we have the community-based health insurance, where as a group, as a community, you have coverage of certain illnesses. There are strengths, there are weaknesses in that as well. I urge you to know these slides. Slides 18 straight to 22. They are important. Even 23 as well. All right, so the takeaway points for health for how is healthcare funded is that you don't have one particular type of funding for healthcare. There are several types. You can have national, private, voluntary, community-based. Healthcare is expensive. You need to first of all understand that healthcare is expensive. I want you to understand as well that healthcare spending is determined by the location that you are, the type of the diseases that burden your healthcare system in the area that you are in a certain, in whatever part of the world. Tropical diseases will be different to cold temperature diseases. Respiratory diseases will be in countries where there's lots of sand and dust versus countries where there may be high wind. So the different areas would have different illnesses, which would propel you to spend more on certain illnesses. More countries that may have a higher burden of chronic disease would spend more on chronic disease versus another country that has a higher burden of infectious disease. So understand these things when it comes to prioritizing finances for health and how healthcare is covered. Okay, let me ask any question on those last two. When did we do quality? Did we do quality before primary healthcare? I know for sure self-management was the last lecture, but was quality done before primary healthcare? Can someone confirm for me? Okay, Matthew, but did we do quality before primary healthcare? Quality was the last. Okay, quality was the absolute last. All right. Okay, well then let's go to primary healthcare. So we did a lecture of 10 slides on primary healthcare, and I remember telling you primary healthcare is about access to healthcare. Primary healthcare spoke about communities, about ensuring that the community is healthy, the community has access to healthcare, about self um, self becoming self-sustainable. Guiding principles of primary health care is every citizen having a right to health care, having equitable access to health care based on needs. So primary health care is access, equitable. These are words that you need to be always having in your mind when you're thinking primary health care. The role of the state the state has an important role because they have the authority to ensure that certain things are done to facilitate primary health care. The structure that is needed for primary healthcare, development of human resources and facilities, organizing and arrange your health resources in such a way to improve access and to improve equity, integration of public and private healthcare services, delivery of healthcare through primary, secondary, and tertiary healthcare. And we went through what is an example of primary, what is an example of secondary, what is an example of tertiary. I hope you all remember these things. Primary would be like your private doctor, your pharmacist. Your secondary would be your health center, your small clinic. Your tertiary would be where surgeries can be done, overnight stay occurs, specialist services. Structure again continuing economic support through public financing and foreign aid. We spoke about what is an example of foreign aid, PAHO, WHO. Public financing, using the state using its tax resources to finance things that are needed. Management through strong leadership, policy formation, regulation, M&E, monitoring and evaluation. We then went on to talk about the social determinants of health, and we mentioned things like overcrowding, housing, sanitation, transit mode, and we spoke about immigrants being affected by these things in particular right now in their own country and in our country, in our host country. Occupational hazards, how dangerous is your job? Environmental hazards, where you live, or where you have to engage in social activity, how dangerous is it? We spoke about the daddy and the daughter getting gunned down from a drive-by shooting. These are environmental hazards. The things such as crime, those things affect your healthcare status. Those are social determinants of health. The impact of globalization and socioeconomic, socio-political factors. Some barriers to primary healthcare would include social cohesion. Believe it or not, availability of food. You might take for granted that some of you might have breakfast, lunch, and dinner. That doesn't apply for every single person in your community right now. Working conditions, and all of these things are barriers to adopting a healthy behavior. In other words, right now with this coronavirus surge, you're seeing on social media. Biana, you deleted a message. What was that you said? Um, you see now persons are saying they went to work because they were sick, and they had to go to work because their boss tell them you have no sick leave, and your boss say there's no pandemic leave right now. So people go to work sick, and that's how this thing gets transmitted. So all of these things, an environmental hazard, your occupational hazard, how are these things the barriers to adopting a healthy behavior? You might want to stay home, but how staying home don't pay your bills. And this is where the authorities need to come in and step up to facilitate persons making healthier decisions. And right now, this is healthy decisions, not just for the individual and his family, but for the country at large. This is a real public health issue. Challenges and limitations. Economic challenges, political will challenges. We talk extensively about political will, shifting of resource spending on resources other than um, spending it on healthcare, but also spending it on things that promote healthcare that would improve the social determinants of health. Just give me 1 minute there, right? Right. Human resource. You always have a shortage of skilled human resource. There's always a shortage of nurses in the world, continuous shortage of nurses in the world. Public policy development and infrastructure, getting the right policies made. Environmental and urbanization, unplanned development, shanty towns, places that do have good sanitation. I remember using environmental issues, and I use the example of Demerara Road, where there were villagers who were using old battery to put for mud in their yards. Batteries lead. The children develop lead poisoning. Culture and lifestyle changes from eating unhealthy fast foods. We have a culture of lying, and we spoke about this earlier. Changes in the family structure and the values, promotion and glorification of lawlessness. This is a real challenge that I am emphasizing once again. We continue to promote and glorify lawlessness, which lead to the demise of our fellow citizens. Gangster life. These are real challenges to having good mortality rate. I mean, I hope everyone can feel the sense of loss of that 3-year-old girl, 2-year-old girl that died with her daddy, and all the other kids that die as a result of stray bullets and living this lawless life. Issues in the Caribbean, such as unprotected intercourse, early sexual initiation, all of these, teenage pregnancy and HIV, all of these are real issues that impact mortality in the Caribbean. These are real challenges. All right. So that's primary healthcare in review. And I'll move straight on to self-care management so that we can get completed by 10 to 11. So the concept of patients as healthcare managers is simple. The patients are taking control of their own health. The patients are taking control of their own health. And we spoke about the gap between professional and patient being big and moving down where it's very close. We spoke about the communication between professional and patient, where professionals spoke down to the patient and the patient just listened. And then it moved to the patient, that leveling off a bit, and the patient now actually having two-way conversation with the professional. And then we are now at a stage where the patient can actually tell the professional, and this is what self-care is about. The patient can tell the professional and can partner with the professional, the healthcare professional, on what their illness is like and what plans we are going to create to self-manage their illness. All right? So this is what self-management is about. Patients as their own self-care managers, and the chronic disease care model was used. The definition for self-management is on slide 5. Please learn this definition. self-management support. And the slide number 7 distinguishes between patient education versus self-management support. Patient education is the old way. Self-management support is the new method that is trying to be encouraged or used to to have patients become empowered. Remember, I defined empowerment as providing the right room for individuals to make the right decisions. You cannot empower somebody, but you can give the right environment for them to empower themselves. All right, so we're going straight to slide 14 and the self-management in the chronic care model of assess, advise, agree, assist, arrange. All of this are necessary for the development of the personal action plan for the patient. Assess, advise, agree, assist, arrange, assess. What's the problem? What are we dealing with? Advise, give your professional opinion on to the patient. Agree, both of you agree on what we are going to do. Assist, continue monitor the patient and what they are in the treatments that they are going to be taken. Arrange, make sure all of these things are arranged properly to continue to plan, do, check, act, to monitor. And we went on in each slide thereafter to look at how we go about each part. But this slide number 14 is an excellent summary for you all to look at to learn. And metrics involved all the time. You have the ruler that you can grade yourself. The person can be graded on how well they have been doing. And the personal action plan specifically goes on slide number 25. What you want to do, describe it, how, what, when, where, frequency, barriers that might be exist in the personal action plan, plans to overcome the barriers, follow-up plans. All right, and then we have some examples later on. Um, all right, so that is, in a nutshell, your review of self-care management. And the last slide there is where we spoke about the gap shortening and then moving from professional patient to now person, where the person feels as though they are speaking to another person who can help and assist them in managing their disease. And this is where the trust is going. We are moving toward persons taking real responsibility for their health condition and taking the steps needed with guidance, of course, to manage the healthcare. It's done usually right now with insulin patients. Insulin patients generally are. Boss was Trump. Boss was Trump. I don't understand what you're saying, Vasudeva. Boss was Trump. Boss was Trump. And asked Vasudeva, explain what you're saying. Um, yeah. So insulin patients, they are advised to test and know what dose they have to take the insulin shot. Now, similarly, in all illnesses, now I know you said boss said there was okay, yes, the boss, okay, the boss never said have no pandemic, the boss just say you have no pandemic leave, the sick leave, you have no pandemic leave. Normally we have sick leave and then there is pandemic leave. So there was pandemic leave was something that was supposed to have been done to facilitate all over the world persons who are affected by coronavirus. Oh, Biana, PHC then quality. Okay, that I now seen that the primary healthcare and quality. Okay, good. Thanks, Biana. Um, right. So are we good to go there? Let's go straight into the last lecture, which is the quality lecture, and then we'll be done for the day. And oh, we have to talk about your exam first. Let's get this done quickly. So this is 30 slides. Okay. All right. So issues in healthcare today: avoidable errors, underutilization of services, overuse of services, variation in services, um, dissatisfied clients. Quality can fix this. And I remember telling you that in all healthcare organizations, whether be it primary, secondary, or tertiary, you'd see feedback forms, whether be it in your doctor's office, your pharmacy, your hospital. And in tertiary institutions, there is actually, in your regional health authorities, there's actually a general manager for quality. It's so important. And we looked at the movement of quality control from in the 60s. That still exists today, yes, but we have advancements to quality assurance and continuous quality improvement, and now total quality management. So total quality management is an organizational tool, a management tool that helps your organization continuously develop and monitor its product and service. Total quality management, TQM, is a management tool that continuously looks at your product or service. And we looked at some dimensions of quality. What we looked at: performance, we looked at reliability, durability, serviceability. Aesthetics, perceived quality, conformity to standards, all of these things. And in different industries, we look at examples of what are looked at when quality comes into perspective. The healthcare industry: correct diagnosis, minimum wait time, lower cost, consumer products that are properly made, defect free, and are cost effective. And you would see in nearly all of the industries, there is always an element of quick and low cost. In all of these industries, quick and low cost are always things that are looked at to help measure the quality. And on slide 8, we went on to look at what is considered quality, and the different gurus like Crosby, like Duran, like Deming, all of these people who what they define quality to be. We spoke about ISO being an international standard organization that looks at the gold standard, the benchmark for when products can match a certain standard. Definitions of quality, whether be it product based, user based, or value based, or manufacturing based, the different industries again. I remember detailing, and this is on slide number 11. I remember explaining to you guys that complaints aren't bad, comments aren't bad. Complaints may be rough, complaints may be hard to swallow, complaints may be bitter. However, it's an opportunity for feedback. A comment may be better in that the language might be nicer, it might be a compliment, but it's feedback nonetheless. And I want you to start accepting compliments in the same manner as complaints. Maybe it should be the other way around. Complaints should be the other way around. Because complaints generally have a negative connotation and compliments have a positive connotation. I want you to start accepting complaints in the same manner that you accept a compliment. You get a compliment, you smile. and you use that for motivation. Similarly, you get a complaint, you listen to the complaint, you take note of the complaint, you investigate the complaint, and you can therefore take action on the complaint. Nobody is saying that the complaint would lead to punitive measures, to persons getting in trouble, to persons getting fired, to you having a fight with the person who gave the complaint. Complaints are feedback. Some people would just leave your business without saying anything, and you'll have lost a customer forever. When somebody complains to you, you get an opportunity to fix what they perceive to be wrong. Take home points, guys. All right, and William Cooper Proctor, from most likely from Procter and Gamble, I can confirm that for you. He said the first job we have is to turn out a good quality merchandise that consumers will buy and keep buying. If we produce it efficiently and economically, we will earn a profit. And we use the example of the mighty KFC. It's a bad example for health, but it's a good example for quality and consistency of product. And then we looked at the historical perspective of quality methodology. I'm not sure how much questions came from this. I don't think I did much questions, but I'll have to confirm. All right, and you see here on slide number 17 where it moved historically from statistical quality control, which is still used today. Statistical quality control is still very much present today, to quality assurance, which is a larger department that's more than just numbers, to total quality management, which is a management tool to continuously monitor, evaluate, and reproduce high quality products based on the customer's needs and the customer's feedback. All right, on slide number 19 compares quality improvement versus quality assurance. And they both have a role. They both have a role. Quality improvement has a more management perspective, whereas quality assurance has a more technical component. Understand what I'm saying? Quality assurance has a more technical component to it, and quality improvement is more management control. Okay? Then Deming had his 14 principles. There were some questions from these principles, so please get familiar with them. Right, we went through all of these. And quality does not occur by accident. You have to identify, understand, and agree what the customer needs and plan to achieve those customer requirements. This is where we introduced the plan, do, check, act cycle on slide 25. And there was an amendment to it where we then had the define, measure, analyze, improve, control process, which is an augmentation of the plan, do, check, act cycle. Plan, do, check, act cycle is something that you would have seen before in your HR lectures with me, and it's something that you're going to see. It's something that you should be using throughout your management career. Plan, do, check, act. It's very similar to systems theory as well. You plan what you have to do, you get it done, you see how well it's done, and you act on your feedback to do it all over again in a better sense. All right. And yes, see clearly, as I was saying on slide number 29, it has a systems theory component of it. And that's it there. That's it there for the review of all your lectures. Any questions before we look at your exam? And can someone send me what the exam questions were? Or let me see if I could get it here. Um, I think I sent out an email. Any questions, guys? And can someone remind me what the your exam questions were? All right, I'll get it an email here. Right. Um, okay, right, Sarvish. List 4 applications of health of ICT in health and explain the advantages of ICT. So that would be your first lecture. No, the second lecture. Let me see the question again. 4 applications, right? So um, applications of ICT in health, right? That would be like on slide number 8. Slide number 8, and the advantages of ICT. All right, advantages would be slide number 15. Pretty straightforward, but remember you need to show me that you can understand the concepts without completely um, regurgitating the exact words here. The second question was give a concise definition of public health and list the steps approved, right? So concise definition of public health. The science and art of preventing disease, prolonging life, and promoting health through organized efforts of society. That's a good, concise definition. And list the steps in the public health approach. The steps in the public health approach would be what is the problem? What are the risk factors? What's the intervention that could be made? And implementation. Those are your steps in the public health approach. Define, identify, develop, and test, implement, and monitor. Those are your public health interventions approach. And you would have to explain yourself so that when I read your answers, I can see that you understand the concepts. And finally, explain 4 types of health system financing. The 4 types of health system financing would be the national or state funded, um, um, social, which is employer employee, voluntary, and community. And you'll have to just give a brief explanation of what was meant by that. The slides have the information. You need to read the information, assimilate it, and put it in your own words. All right? So pretty straightforward. Your final exam. Let me see your final exam. Your final exam has 25. Oh, actually, your final exam has I'm seeing 29 MCQs. Weird number. I don't know if something is missing there. I'm seeing 29 MCQs and structured questions of 5 structured questions. And most likely you might end up getting 4 or you might get the 5 structured questions. So that's it there for your exam. That's your final exam. That's your review. And we looked at your first in-course assignment. Your second in-course assignment will be structured questions again, and it will be based on the lectures that we didn't do. It will be based on lectures, human resource. No, it would be on primary healthcare, self-management support, and quality. I have to submit those questions actually by this week. I'll have to submit those questions. All right, good. So any further discussion, guys? Any further issues? Any queries? All right. Well, if there are no further issues, let me state just as I did yesterday. It's been a pleasure to teach you guys. I hope I would have helped in helping you understand how would this marks be allocated for the 5 structured questions? How much would each question be worth? I don't know if you're trying to get from me here some information that I ought not to tell you. Um, I think oh yeah, all the questions are the same amount of marks. Just one may have one more mark than the others, but they're all the same amount of marks. 5 marks. Also, in case you may have forgotten, we're supposed to have an additional. Yes, no, I didn't. I remember today we're gonna discuss your first in course for farm admin. I didn't forget. So I'm saying, oh no, actually I've seen everyone at 11. Okay, right. So maybe at 12 I'll say my goodbyes then. Um, thanks, Vasudeva. Yes, Savish, I remember the class. We're gonna take a break and then we'll come back. The structured questions are 5 marks each. One may have 6 marks. All right, so we'll end this stream now, and I will see you back on the other side of 11 o'clock, where we can do the review of your first in course in farm admin. All right, see you guys soon.